Yes?
In the WebEx, everything is good.
Alhamdulillah, good. So I want to be sure because also Zoom with Hawthorne is good also. There is no any interference so far.
Okay.
So
you
we
are
will
on YouTube right now.
In the last 10 minutes, like 8.
Yeah, well, I will do is I will mute and unmute people so it's easier.
Okay, excellent. So let me know. And your brother Khan Almas?
No, I'm brother Muhammad. It just says I see it.
Muhammad what?
Muhammad
Habib. Okay, Muhammad.
السلام عليكم دكتور نوح.
السلام ورحمة الله وبركاته. أهلا وسهلا شيخ حمدي. زي الحال.
الله يكرمك. الله يكرمك. احنا في البانلست.
Can you see me?
That's محمد حبيب. ICH me and you إن شاء الله.
محمد حبيب. Okay.
إن شاء الله.
محمد حبيب.
عليكم السلام محمد. How are you?
Okay. Go ahead and introduce 8:15 already. Go ahead.
Assalamu alaikum, everybody. Welcome to our Monday night. Let me start the recording. Give me 1 second. Okay, record. There we go. Assalamu alaikum, everybody.
Welcome salam wa barakatuh.
Welcome to our Monday night ICH Hawthorne Masjid nightly program. Special guest with us tonight to talk about a very important topic. We have Dr. Muhammad Noor.
Mahmoud.
And the Dr. Muhammad.
Mahmoud. Yeah.
Sorry about that.
It's okay.
We have Dr. Mahmoud Noor.
Yeah.
And the topic of the discussion, COVID-19 facts and myths. Dr. Mahmoud Noor is a board-certified emergency room specialist for more than 35 years. He works in Los Angeles at the Hollywood Press and at the Glendale Memorial Hospital. Jazakallah khair, Dr. Mahmoud, for taking our invitation and joining us tonight. And please go ahead and get started whenever you'd like, inshallah. Jazakallah khair once again for this opportunity.
Thank you, Muhammad. I would like to thank the officials at Islamic Center of Hawthorne and also the Islamic Center of Glendale also joining us on Zoom at the same time for this important topic of the hour, actually, not only here in United States, worldwide. I'll introduce myself first. My name is Mahmoud Noor. I'm an emergency room physician. I was graduated from Alexandria School of Medicine in 1978 and came here in 1980. Finished my residency in emergency medicine at Charles Drew UCLA Medical Center and taught as assistant professor for 15 years. I currently work with private groups at Hollywood Presbyterian Medical Center in Hollywood and Glendale Memorial group in Glendale. For 15 years, I've seen a lot of cases, COVID, and there's a lot of myth and facts. And I'm married with 5 children, thank God. And I live here in La Cañada. I'm calling you from my home. I wear the coat here to let me know, it's official, my coat. We are all afraid of the unknown. So when you don't know things, that you being skeptical and afraid and hear a lot of rumors. So I'll introduce you in this 30 minutes, 10 minutes about what's COVID, what it is about, overview. Then the next 10 minutes will be about myth and facts about that disease. And the last 10 minutes will be open session for question and answers. I'm sure a lot of you have questions. What happened COVID in the late last year, 2019? They found out a lot of pneumonia cases in the province of Wuhan in China. And they tested that. They found is a virus related to the severe acute respiratory syndrome virus that, if you remember, a few years ago, there was SARS, and there was also MERS, the Middle East, also respiratory syndrome virus. And they found it is part of the coronavirus. It's an RNA virus. And the other one is, they call it COVID-1. So this one, they call it COVID-2. What's COVID stands for? The first 2 letters, COVID, this is corona. And virus infection, that's COVID. And the last word is 2019. That's when the World Health Organization named that virus. And that virus, a little bit more severe and something new. They don't think it was man-made. They think it might have been transmitted from bats, which has a similar DNA close to humans. And nowadays it's transmitted from humans to humans. And mainly it's transmitted to the body by respiratory droplets. If you have like coughed or sneezed or anything like that, or you touch the surface and go through the mucous membrane in the mouth, in the nose, or in the eyes. And that's how it's transmitted in the body. Once it enters the body, it can go to respiratory system from the nose, the throat, can go down to your lung and cause a lot of problems similar to the flu. Many of us got the flu virus and it heals, it gives you the same symptoms. It gives you fever, body ache, runny nose, cough, sneezing. But thank God, the majority get healing from that. This virus is a little bit different. It's more severe, 3 times severe than the regular virus. And it behaves in many ways. It can infect the whole body. It can inflame that the other parts of the body, your GI system, can cause you nausea, vomiting, diarrhea. This is another part. It can affect the heart, because inflammation of the heart can cause irregular heartbeat. Some people, they die suddenly. It can also cause a stroke because it affects the blood vessels, and some of the blood vessels can get clots. We have seen people with clots and getting stroke, amputation. This is in very severe cases. Does it affect the children too? Yes, it affects children with something called Kawasaki type disease inflammation. This is a less. Does everybody get COVID? The most people, they get it, of course, the people with a pre-morbid condition, the elderly, those who have sickness, they have diabetes, they have cancer, they have heart problems, and these are the people more vulnerable. But nowadays, it's getting for everybody. Even younger people are getting it. How it's spread again? We said spread through droplets. If somebody, yes, if somebody coughs or sneeze, if you touch, and this is how you can get it. And what are the symptoms when you get this virus? You can get fever, can get cough, can get trouble breathing or chest pain, and this is more serious problem, muscle ache, body fatigue. You lose the sense of your taste and smell, and you can get headache, and nausea, vomiting, diarrhea. These are some of the symptoms. And you can get, these are majority of the people, 97% of the people, they heal very well and they go through it and like flu. Only like maybe about 3%, they succumb to this with severe disease, and some of them, they pass away. About more than 20 million people got infected worldwide, more than 500,000 passed away, is still spreading. And how do you know that you're having the virus, that you're going to get the flu? And if you get this flu virus, and like, stay at home if you don't have any trouble breathing, if you don't have severe chest pain, if you don't become like somebody around you sickness, lethargic, and something like that, stay mostly at home. If you have serious problems, especially trouble breathing, and the person is like become lethargic, that's when you call your healthcare provider, call 911. If you have mild disease, don't go to the hospital, please call first, because in the hospitals, when patient comes in, we usually have a tent and check you outside, check your temperature, see how you're doing. If you're doing fine, we'll let you go home. If you're not doing well, we immediately escort you to the inside isolation rooms. And when the ambulance brings sick patients, of course, we have isolation rooms for them. And we are wearing all the PPE. What's PPE stands for? Personal protective equipment, like face mask as usual. And you can wear like shields like that. And of course, we have gloves. And sometimes we have helmets with air purifier. And that's when we admit the patients. And if they are mild cases, we admit them to telemetry floor, like monitoring them. If severe cases, they need to be put on life support, then we have to put them on life support and give them medications. Is there any cure for this disease? Until nowadays, supportive care is the most thing. The medications, there are many medications, but the one that's so far have hopes and did reduce the mortality is remdesivir. This is an IV injection, antivirus medications. And is there any other medication? Some of the other medication they can support, and not everybody should use it. Chloroquine, the anti-malaria drugs, the WHO is not recommending that. It can cause more harm than benefits. The cortisones or steroids, these are used in certain cases, not in all cases, because it could be harmful in some cases. And supportive care fluids, high flow oxygen. We give the patient oxygen 100%, and hopefully that will help. If not, we have to put the tube down their throat, water on the respirator, put them in bronch position, and supportive care, and inshallah they will heal, but about 3 times mortality rate than the regular flu. That's how this coronavirus or the COVID-19 virus is. And how do you protect yourself? And you can protect yourself by many modalities and protect your family. That have the hand sanitizer, first of all, if you go in public, always wear face mask. The research now recommends face mask, especially if you are in a closed space, and stay at home as much as you can. If you go outside, of course, you have to wear the face mask. Limit contact with other people. Don't go to big gathering. There is a family recently, a person came from overseas. They have a big gathering on Sunday and they all got infected, and the eldest one have passed away. So be careful that you're communicating with people that you're not familiar with. Only with the close family. Limit also friends visit. Avoid sharing personal items, and wash hands frequently with soap and water. After you go to the bathroom, before you eat, before you prepare food, if you like fill the gas in the gas station or touch things in the market, and always keep hand sanitizer, spray or liquid in your car, and you can just spray or clean your hands. This is very good. It can kill any virus that touches your hand. And avoid touching your eye, nose, and mouth, of course, because it could be the virus from any sputum or any droplets you touched and it goes to your nose. That's how people got infected. And also clean surfaces. If you have at home or if you're around somebody, clean the surface with some disinfectant, wipes, the knobs, the light switches, things like that. That will help reduce the risk. People with chronic lung problems, emphysema, heart problems, cancer, low immunity, they should also keep away and stay away from those who are maybe sick. And if somebody is sick around or been exposed to corona, have them stay away for at least 10 to 14 days. Now that used to be like 14 days, 2 weeks. Now reduce it to 10 days at least. And do I need to get testing for corona? Call your healthcare providers. If the sickness is more than normal, they can test you. They test by swabbing a swab in the nose. That's where the virus concentrated, or in the oropharynx. And the Yale University, they have new one with saliva. That's the PCR test. PCR test, this is the detect the genetic material of the virus. And this is the most accurate test. And there is another blood test called the antibody. Antibody is positive, that means you have been exposed. Can I be a carrier and not showing symptoms? Yes, you could be a carrier. You could expose somebody, carry the virus, but your body has not reacted to it. And you can pass also the virus to others. That's when you're exposed to anybody and you still feel good, still isolate yourself at least for 10 days to 2 weeks to protect yourself and to protect others. And what's the future for this virus? Now there are 120 centers are trying to develop vaccines. It will not be available by the end of this year. And this is the third stage to test it on humans. And hopefully, inshallah, it will be available beginning of next year. The one in Russia that they developed, the WHO, the World Health Organization, did not recognize it yet because there is lack of evidence and lack of trials. And hopefully soon, inshallah, will be. This is the give you just an idea about this virus, how it's transmitted, what presents in your body, how to deal with it if it happens in your family. This is the first part. And the second part about, which also will explain a lot of stuff we were talking about the myths and the facts. If I'm outdoor, I don't need to practice social distancing. No, the fact is, it is less likely to catch COVID in an open area. That's why nowadays your restaurant places open area is less, because the concentration of virus will be much less exposed. At least keep social distancing at least 6 feet from the others, and even elevator they limit the numbers. And if everyone around me is wearing a face mask, there is no need for me to practice social distancing. No, still any droplets from people coughing and even talking, you can contract that. So always wear facial mask and keep social distancing at least 6 feet. Stay in an open area, well aerated area. A cloth face covering doesn't block the virus. I need surgical mask or N95. N95 is a surgical mask we keep for healthcare professionals because of the just to keep it for them, but you still can mask in the market. Face clothing also, it will help block the droplets, and recent research said people who did not wear masks were more exposed to get the virus than those who did not. The face covering doesn't prevent the spread of the COVID-19. No, it helps stop the evaporation of any droplets when you talk or sneeze. And there is no research support recommendation of wearing face mask. No, the more research now, they support the face mask. So that's how important it is. It's now mandatory in many states. The tighter the face mask will be, the better. No, when you wear the mask, it has to be just snugged well around your nose, not too tight, not too loose, to prevent the droplets from entering out or going out. I only wear mask in high risk area. No, wear the mask all times, especially indoors, and when you're ride sharing in a bus, in a train, in the metro. And if you are a single family or family members, you don't have to. In the car, what was foreigners or people you are not familiar with, you have to wear it. Young people, they don't get COVID-19, only elder people. No, nowadays, of course, older people with medical problems, serious, they get it more. But nowadays, even younger people and those who have like spring breaks, young people, and they have even COVID-19 party, they also still get infected. As long as I wash my hand with sanitizer, I'm safe. Spreading the virus through spoiled droplets, saliva, spit, mucus, and when people yell, sneeze, sing, still. So washing the hands will be good, and cleaning frequently any touched spaces. If you are at home or a place where they think maybe touched the places, always use wipes and disinfectant to clean. If I go to the hospital to see another person, I'll get COVID. No, visiting to the hospitals nowadays are limited. And our emergency room and the hospitals, we have a tent outside. We tell the visitors only very close relatives, they are allowed, very limited, and for limited time. And we have to check them out. We check your temperature, ask you if any symptoms. We may ask you also to wear gloves. And if you are really sick, you have to go. Otherwise, limit visitations for patients in the hospital, only very close relatives and restricted. If I go, okay, COVID-19 spreads through food. This is a myth. There is no evidence that spread through the food. If you swallow it, it digests in the stomach. But if you touch some service food delivery, packages, and disinfected, you may get that. But there is no evidence supporting transmission through the food. Can I get COVID from my pet, from my dog or cats? Unlikely. There are some few cases that the cats or dogs have been infected, but there is no evidence that they can transmit it to humans. Can the virus spread by mosquito bites? There is no evidence until now that can spread by mosquito bites. If I get COVID-19, I'll know it. No, sometimes people get critically ill, they know it, and some people, they are healthy and they spread the virus and they don't know it. So you cannot really tell. I'm having COVID just like a flu. Yes, it acts like a flu, but it has more serious consequences, more serious problems. Like we mentioned, you can get bad pneumonia and your lung gets damaged and you die from that. You can get other mortalities, strokes, etc. If I don't have cough, I don't have COVID. While COVID can cause cough, many people, they have can transmit the virus, but except those who are like having a fever, cough, chills, short of breath, fatigue, we said, muscle ache, body ache, loss of the sense of smell and taste, sore throat. These are some of the signs that may be having the COVID-19. COVID-19 is a hoax? No. May God protect you and your family and loved one. It is a real disease. Some people, they are questioning it. Some about 20 million people got infected, more than 500,000 died, and it's about 3 to 4% more likely to cause death than regular flu. And if someone has been around with COVID-19, I'll get a call from public health. Sometimes if you are in a place and you visit that place and they register your name and you've been around in a public place with COVID, they may contact you, said you've been exposed, isolate yourself, check with your healthcare professional. And if I'm asked that to quarantine and my test is negative, now can I stop and just leave? Even if your test COVID is negative, you've been exposed, it's better to still isolate yourself 10 to 14 days because the virus, when it starts getting to your body, it takes like a week to start. So you've been like first 3 to 4 days, your test is negative, but the virus is there. It takes like a week just to start develop and full blown by like 10 days. That's when we said, if you really have the virus, cold infection will be by that time. And being in the sun or a high temperature, it prevents the COVID. No, still in very high temperature areas around the world, still COVID. It takes like 133 Fahrenheit degree to kill the virus. It doesn't survive long on surfaces, but exposing yourself to the sun to be healthy in an open area, yes. Regular rinsing my nose with saline or gargling with salt water can help. No, there is no evidence gargling or rinsing the nose, except those who are making wudu. Alhamdulillah, this is a good sign. Spraying alcohol, chlorine, or other disinfectant on my body will kill the virus. That's dangerous. Spraying it will also cause harm because if the virus already inside the body, these things, the chemical will not reach the virus. So how do I protect myself and my family from COVID-19? Stay at home as much as you can. We know that all schools now, I feel sorry for all the parents and their children at school. Still, many schools are not going to be even starting this fall. And practice social distancing at least 6 feet. If you are around people, stay 6 feet. That's when the drops will be much less. Always wear face mask and when you go outside. There are many markets now and places they are not allowing you to enter without the face mask. Always keep one in your pocket, keep one in your car, and keep extra one for some people with you when they go out. Cover your mouth with your elbow and with a handkerchief or something, so to prevent spreading the droplets. Clean the high touch area. We said like the knobs, anything surface that you may feel like handrails, light switches. Clean them with disinfectant. And don't work when you're sick. Stay at home. Isolate yourself from the loved ones at home. Have your personal stuff separate. Limit contact. Have isolation, separate room, separate bathroom if possible. And when you're sick, call your healthcare professionals before you go so that they can interview online. You can interview if you go to the hospital in the tent outside, if you're really sick or somebody is really sick with you. And that's when you have to call 911. And this is a nice just form here that we talked about. As you can see here, this area here, this is very nice for about keep social distancing, cover yourself with the face mask, and clean your hands, wash with soap and water, keep distancing, stay at home. This is, you see all this information, you can have it online. Do I need to have testing? You can go online and find out testing for Corona and LA County Corona testing. There are free places that you can sign in. You have to register before you go. If you have to travel, you have a test. There are places that you have to pay a fee and you can get the PCR test. Traveling recently, some airlines and countries, they require you to have a negative COVID test before even you travel. So you be careful. When you travel, also I recently traveled overseas, you have to wear the mask entire flight. Only when you eat food or drink, you can take it off. You cannot walk in the aerosol in the area. They have to stay sitting. You cannot go and wait in the front of the bathroom door. You have to wait until the green sign that the bathroom is ready to limit contact with the people. Children, yes, they have to wear face mask also, but those who are 2 years or younger, they don't have to because they cannot control them. But older children, yes, they have to wear face mask. And that's basically, now you know about coronavirus, how it spreads, what kind of damage or body aching and problems it causes, how to prevent yourself and a loved one from catching it. And that's basically the overview of that virus, which you are still learning actually about. Many healthcare professionals, they are still learning about this new virus, which behaves in a very different way from other viruses that we know about, like the flu viruses. And this is basically the information that I would like to give you, because when you don't know about things that you get scared, but now when you know about this virus, you know how to prevent yourself and and protect your loved ones. There are some equipments I mentioned, like always have hand sanitizer in your car or at home. When you touch any service outside, after you go to the market, fill up gas, etc., you can clean your hands. And of course, wearing the face mask all time outside, it does help. And there are really new research said it does. Those who did not wear it, they were more prone to get coronavirus infection than those who did not wear it. Hats or covers, we wear this, of course, in the hospital. That also prevent for many droplets dropping in, touching it, etc. You don't have to, but those, mashallah, who has wear scarves or even niqab. Now everybody in all over the world, they are wearing niqab. Gloves, important, keep them in the car in case you are in a place that you suspect they have a lot of people touched. Wear the gloves in your hand and use it one time and throw it away after that in a secure area. Measuring temperature for the loved one, you can, this is like infrared thermometer, and you can buy it online in any pharmacy, and you can just 3 inches away, and you can push it to the forehead, and it will give you a reading. You're going to find that. And my reading is 36.2 Celsius, which is like 98, which is normal. You're going to see that in places when you go to restaurants, go to the hospitals, etc. You can have it at home also. You can measure also your family temperature in case. For those who are sophisticated one, there is a machine that measures the oxygen saturation in your body. This for those who really go sophisticated or out of the way. And this is the machine. Those who really have cough, and there are some people discovered them, they have trouble breathing. When they measured the oxygen, it was very low, below 94%. When I put it here and I push on it, it reads automatically, and it's reading now my oxygenation in your body, and it's reading 97%, which is good, and my heart rate is 92. This is also, they sell it in the pharmacies. For those who have no access immediately, who want to be sure they are okay, they're breathing okay, also this sold also in the stores and pharmacies, or can order on the line. And protective equipments, have it ready at home in your car. And make, of course, a prayer, the dua, the most important. May Allah subhanahu wa ta'ala protect us from all these diseases. And if you have any questions, and there is a lot of resources online, and I give you an overview about this virus, how it presents, how to protect yourself and loved ones when you go and seek medical attention and medical help, how the equipment that can help you is at home, in your car, or at business. And if you get sick, of course, stay home. And if you have any questions, I'll be willing to answer your questions. And hopefully I answered most of the myth and the facts provided to you. Okay, Brother Habib. So if anybody has a question or did not answer in my session, please, they can ask, and I'll be hopefully to answer their questions if they have any concern. Yeah.
Misconceptions. As Dr. Nu said, if you have a question, please feel free to raise your hand or post it in the chat, and I could ask it on your behalf. We have a couple hands already.
Sure.
So let's start with, I think, Dr. Joseph or Sheikh Hamdi have a question. They have their hand up.
Sure.
Sheikh Hamdi, do you have a question?
I have a question, Habib.
Go ahead.
Go ahead.
رايك دكتور محمود جزاك الله خير هذا جودة معك.
أهلا وسهلا جودة دكتور جودة.
But now these days we have a lot of a lot of people are getting infected by COVID.
Yes.
And they are close to us.
Yes.
So if they get quarantined for 2 weeks and they get tested, let's say I don't know how many times you should get negative test.
Yeah.
So after they are tested and they are quarantined, is it okay for them to, because a lot of people are afraid once they hear somebody has COVID, that's it. They put X on him, that is, don't even come close to him, don't talk to him, don't let him come, So what's the safe measure?
After
infected?
If they quarantine themselves for 2 weeks, they are allowed after 72 hours. After that, if they have no symptoms and they have a negative PCR test, it's okay for them to go and have regular activities, because the virus will have shown if they really get sick, and still they can be carrier. That's why we recommend the test at the end to be tested to be sure there's no virus. Some people who have infected and they went through it and they still have the positive test, but they are not infecting others. The virus is most virulent in the first week. That's when it is really the highest, and that's when it spread the virus more. The concentration will be high in the body and the droplets. And after they healed or they are fine, there may be still detected, but they are not infectious as. That's why we said even 72 hours after you've been quarantined yourself, if there is no any symptoms and the test is negative, it's okay, allowed to go and join the community as regular, and still take your precautions as I mentioned. And that's when the many dentists now and very close professionals, and they are also limiting that, or they're using their precautions so that they limit the transmission. Yes, go ahead. Anytime.
Assalamu alaikum.
Alaikum assalam wa rahmatullahi.
If you have any like showing corona, start something from an ear hurt or any bothering you in your ear.
Yeah, I'm answering now questions from Hawthorne first. For Glendale, they have to really to wait. And let me answer your question with that. Yes, go ahead.
You can go next.
Okay.
Okay, we'll come back to Brother Hamid. Let's move on to Mahmoud Quaida.
Okay. Assalamu alaikum, Mahmoud.
Assalamu alaikum.
Go ahead.
Assalamu alaikum, Dr. Mahmoud.
Assalamu alaikum. How are you doing?
Alhamdulillah. Thank you for taking the time to give us this valuable lecture.
Oh, no
My
problem.
question, you recommended, thank you. You recommended that when we go outdoors, you have the mask, face mask.
Yes.
But if you go like to the park and you're running, do you recommend having the mask? Because my understanding, it will limit the oxygen.
No, there's no proof it does not limit the oxygen, because the way they designed this material, the air go through in and out, but it only filters the viruses. That's why the material they made, the virus is very microns and they spread. But if you're in an open area, if you're, of course, if you are far away from people, you don't have to. If you are in an open area, running in the park and the trails, and the beach or swimming, you don't have to. Only when you feel like you're close contact with people. If you're running around people like marathon, like, yes, wear it, because you never know this person running next to you. But if you're running by yourself far away, more than 6 feet or even longer, we recommend it even 10 feet, as you don't have to wear it as long as you're in an open area. So it's not very strict. If you are in the car with your family, you don't have to, because you know your family living with them. But you wear like ride sharing, bus, metro, airplanes, of course you have to wear it. So it is like your discretion. If you suspect you are close to people, wear it. If you suspect people are far away, you don't have to.
Thank you, Dr. Mahmoud.
Anytime. Next.
السلام عليكم دكتور نحوح.
وعليكم السلام.
السلام
عليكم عبد الملك. الحمد لله. Fine.
الله يجزيك الخير.
Anytime.
عندي سؤالين إذا بتريد.
Yes.
I have two questions. First question, when someone is asymptomatic,
yes,
how long he can infect others, and how they know that he can still infect others? The other question, why if someone is infected, they have to wait until they get very bad to go to the hospital? What can we do as intervention before the virus reached to the lung and damaged the lung and the oxygen became very, very scarce?
Yeah, for the first question, that's how this virus is a novel new virus. It's not like the other flu, regular flu. And some people, they can, that's actually like some healthcare providers, they have got infected and many of them, they passed away in other countries and even here. And because when the patient comes and they have no symptoms and they don't take their guard and they get infected later. That's how they found people getting infected from people who were healthy looking. And they have been exposed to others. And that's why we recommend if you have been exposed to somebody who has coronavirus and you have to quarantine yourself because many people, they can carry it and they are healthy. There's no sickness. And those who carry it and they get sick, it will 98% or 97% will be act like a regular flu. Only like the 3%, we said that's when you get sick. I cannot take everybody in the hospital. I'm going to overwhelm the hospitals, will fill it up with non-serious condition. That's why we recommend the symptoms that I mentioned. If you get trouble breathing, you can call 911, go right away. You don't have to wait. If you get too much chest pain, if you see somebody becoming lethargic or sick or vomiting profusely, diarrhea a lot, becoming really sick, that's when you go. But if you have a regular flu, we all got flu, body ache, some sore throat, runny nose, cough, I send them home from the hospital. I don't even let them in. But if they are really sick, I let them escort them in right away. And that's when your discretion and your intuition that you know, you feel. If you or the loved one's sick enough, you call or 911 or you take them to the hospital. But if they are mild cases, I cannot, some hospitals all over the country, and they have overwhelmed. They have to transfer patient out. But alhamdulillah, thank God, in California here, we're still managing and we have a good governor. And this is important, the leadership. The leadership is very important of managing the policies of this disease. Some leadership, they were denying scientific facts and they all let us suffer. I like Dr. Fauci, his predictions before this about the disease were all right because he's a scientific man. That's when we listen to the scientific people, listen to the doctor, listen to the recommendation of the CDC. CDC stands for Center of Disease Control and Prevention. WHO stands for World Health Organization. You can go on the website and see the recommendation and look at the facts. Yes. Anytime. Anybody else has questions? I know it's Monday, the long day. And
Assalamu alaikum.
Dear brother, my question is COVID-19 cycle, let's say if the person, he or she get infected, and then after 14 days, staying in, like in isolation, that alone, after that they did the test and they are negative.
Yes.
So there is a chance this person, he might have it again.
There are many reports said that when you get the infection, you get some immunity and your body has some antibodies, and even they are using these people antibodies from the blood to treat people who are really sick, and there was some success with that. Your body has antibodies, but they said it lasts for a few weeks. Some people last for 90 days, and that's why it goes down, and some people, they get reinfected again. But it's not that severe like the first time. So there is a possibility people get reinfected second time because the antibodies last for that many weeks. They are not everlasting like other diseases you get, like other viruses or flu. And the chance to infect others, I said usually in the first week, that's when the shed the virus the highest. But if you get cured and you are fine, and even little virus will be in the body, it's unlikely to spread it to others. Okay.
السلام عليكم.
السلام عليكم يا دكتور نور.
وعليكم السلام ورحمة الله وبركاته, Samir. Fine, how are you? Yeah, any questions?
Yeah, quick question. First, people with chronic disease, what, I mean, besides all those protection, first, why they are more susceptible to have the complications, and what extra they can do? And another piece of the question, how about going on flights overseas or even domestic? Is that recommended? Does the chances of catching it more when you fly for a number of hours?
Yeah, why people with chronic disease, they get it the most? Usually we have people with the chronic disease, like those who have chronic kidney problems, emphysema, asthma, heart disease, diabetes mellitus, morbid obesity, and heart condition, coronary heart disease, cardiomyopathy, sickle cell, and they have lower immunity. The body has lower immunity, lower antibodies to fight the virus. This virus is very strange. It enters your body and goes to your respiratory system and to your lung, and the immune system doesn't recognize until late, when they already did, like, they enter the cell, they took over the cell, they damage it, and go to another cells, and so on. The body reacts ferociously with immune system, and that's inflammation actually causes the more damage. You said, like, the immune system, when it reacts so bad, that's when they use some steroids or some medication to lower that reaction. And that's why we recommend those who have sicknesses like the one I mentioned to may take more precautions, stay away even from those who are sick or even the flu, and to limit their going out. You don't have to travel. If you have to travel, there is travel. I recently traveled overseas. They take your precautions the same way. You have to have a test negative. Some airlines, they recommend that. Some other countries, they can let you in, and you can let you come back actually the States without a negative PCR test, which nowadays the can take half an hour, and you can get from some clinics and some labs, and you can get it free, but it takes like 48 hours to 5 days or even 1 week. And people can travel if it's essential, something really you have to, yes. If not, please postpone it. The fall is coming. Next month it will be starting the fall, and they suspect it will be even more with the piggyback carriage with other viruses that we've been vaccinated for, flu. This virus will be easy to enter the body as you weaken the body. You already have a regular flu virus, and now your body is more susceptible for the COVID-19 virus to do more damage. That's why we recommend limit travel if you can, but if you have to, take your precautions like I mentioned. You're going to wear the face mask entire flight, and you're not going to go to the bathroom standing. You're not going to walk around, and only when you eat or drink. And gloves wearing, and most of the hostess and the airplanes, they're all wearing shields, like the one I showed you over here, that to help, even you're running on the street, thing to help prevent the virus from just getting in touch with you, just spread it away. And they're all wearing face masks, and they're all wearing also gowns, like we wear in the hospital. When you see patients like that, I wear my helmet, with air purifier, the shield, the mask. I wear a whole gown to protect me, and especially when we put patients on life support, that's the most dangerous, and that's when many doctors or nurses got infected, and many of them unfortunately have passed away. But with the protective personal equipments available, thank God, from all over the hospitals now, we have no shortage, and we have very good supply just to protect yourself. So I hope that will answer your question. Anytime.
Assalamu alaikum, Doctor.
I have a question from Hawthorne. So can I answer it first? Yeah, go ahead, please.
Assalamu alaikum. Sister Samira Hijaz, you've been unmuted.
Assalamu alaikum.
Salam alaikum, sister. Go ahead.
Jazakallah khair. I have a question. Does vitamin C help if a person has coronavirus?
This is a good question. Healthy lifestyle, being in an open area, sunny area, well aerated area, it helps. Having multiple vitamins will help to strengthen the immune system. Yes, multiple vitamins, vitamin A, vitamin D, zinc, and these are available over the counter in many places. So taking multiple vitamins a day will help. Some healthy food, healthy diet will help. Liquids, very good, important liquids. We have all these liquids and teas, and this different will help out to make your immune system better and make your body well hydrated. Yes, I recommend that, and they recommend that. We give them in the hospitals too, and we recommend the families just to have a healthy diet, and multiple vitamins will help, will not harm.
Okay, also vitamin D, because I think a lot of people are vitamin D deficiency since they're not going out in the sun.
Exactly. Multiple
really
vitamins. There is now multiple vitamins has vitamin A, B, and D, and zinc, and these are all you find over the counter. It will not hurt to take a few of those every day. Yes.
Jazakallah khair. Thank you.
Anytime.
Assalamu alaikum, Doctor.
Dr. Wu and
Okay,
everybody.
Habib, just a second. I'll listen to one from Glendale. Yeah, go ahead, brother. From Glendale, go ahead. Okay, I'll finish first with Hawthorne. Go ahead, Habib, again. Yeah.
Jazakallah khair, Dr. Nu, for all those questions and the answers. I think Brother Hamid has one question to answer.
Go ahead,
Brother Hamid.
Assalamu alaikum. Can you hear me now?
Yes, go ahead, brother.
Okay, okay. Something's going on with my AirPod. Thank you, doctor, for this beautiful insight into this
anytime
pandemic. My question is concerning, there are a lot of conspiracies out there, like, you can choose from. But, for me, I personally don't believe in that. But, if it comes at the end into, like, you have to vaccinate, is that something that you recommend that we can do? Like, if you have to, like, you have no option but to vaccinate, do you think we should vaccinate?
Yeah, I will treat that like the flu season every year. Every year that they offer in the hospitals, in clinics, and pharmacies, they offer you the flu vaccine available for those, especially those who have immunocompromised problems like sick, elderly, with medical problems. We recommend that. Young people, even with diabetes, etc. It will be almost the same, but this will be more recommended really to take it because it is a serious virus. It behaves in no other way, no other viruses. It is 1 to 3% deadly in cases. We have seen that, even younger people. We have seen doctors and even their sons, nurses, and those who are really working with all their protective gear, they still get infected. Imagine those who are without. So this will be highly recommended to almost everybody to take the vaccine if it's being recommended by the CDC or the WHO after clinical trials prove it is not harmful. And they will not release that vaccine before the end of this year or beginning of next year until it's proven it is successful. Yes, much recommended to take that vaccine if it's available.
For the whole population, I think that would fall
universally,
right
yes.
The hand of the conspiracy theories.
No, there is no conspiracy theory here. There is not man-made.
The population of humanity and stuff.
No? It is a pandemic time. It is something we have never. It turned our life upside down. You see all these changes in our life, so we have to treat this in an unusual way. It is like a war against a virus. It's not like a regular virus like everything. This virus turned all our life upside down and have to have an unusual way, an unusual measurement of fighting that virus. And that's why we recommend once it is available.
My other question is, so this virus, was it a lab made or?
No, there is no evidence. They said it has a close relation to a virus, in fact, the bats al-khafafish in China, and that's how it might have transmitted from animals or birds like this one to humans. There is no any evidence that is man-made. There is no evidence it is a biological war, and until now it is like a natural mutation of the virus. Like we usually get viruses every year. You get vaccination and it changes its mutation to next year to a new form. And that's why you don't have antibody for that virus. That's why you have to get new vaccine for a new flu virus. And that's exactly happened the same way. Unfortunately, it happened with one of those corona virulent viruses, which behaved in a new way, unusual way. And that's where we're all learning every day something new about this virus.
Thank you, Doctor.
You're welcome. Anytime. Thank you.
Those are all the questions we had today. Once again, Dr. Nu, this was a very, very detailed, very great talk where we can take a bunch of lessons, social distance, have the appropriate vitamins, have a good diet, social distance, and apply all the necessary precautions to prevent us from getting the virus.
As you see here, that's my last slide to show you, just to get an idea. And may Allah protect you and family and loved ones from this virus. Make dua, take all your precautions, take your steps, and عقلها وتوكل.
Assalamu alaikum. Thank you for joining us tonight. We are very grateful for the talk, and inshallah we will see you soon.
Thank you for the people of Hawthorne and Glendale for listening.
السلام عليكم دكتور نوح. ممكن أسئلة من Glendale؟
Can you take question from Glendale now, Dr. Noor?
Yeah, okay. Glendale, you can go now.
Okay. Okay, brothers and sisters, please one at a time, not too many to jump in, unless I wanted to go there and mute everybody and allow individuals. So go ahead. There is a sister Jumana. She wanted to get many times, and I have to mute her.
Sure, Sister Jumana, go ahead. Ask your question, Sister Jumana.
Sister Jumana, maybe she left. Okay, how about Brother Majid? Brother Majid, Bakir.
Yes, Assalamu alaikum. My question is it a good idea to sanitize milk bottles, juice bottles that you bring from the store? We normally do that. Is that a good practice?
Drink bottles from, what was the question again? Just one
No,
more time.
when you bring like groceries from the store, like when you bring like milk bottles, juice bottles, like boxes, food boxes, whatever, is it a good idea to sanitize?
Usually, those who stock the food, they are all wearing gloves, they are wearing shields, and unlikely they have any infection. But if you receive the package from outside, from mail, you can, or delivery food, that's when you'll get infection from, but unlikely. Those who like hard covers and you suspect might have been touched, you can just clean them with disinfectant. Otherwise, you don't have to clean water bottles or milk bottles or soda bottles with any disinfectant, because in the market they are all screened, the food handlers or those stock foods, and they all wear shields and face masks, and they wear also gloves. So it's unlikely. You don't have to, unless you suspect something, then you can use sanitizer or clean it.
Okay, anyone else in Glendale?
I think with Hawthorne we answered mostly of all the questions.
Yes.
Yeah. Thank you, Brother Abu Khair, for joining us and managing it. And I hope it was beneficial for everybody. And I'll leave you again for this slide for everybody. Just to, yeah, go ahead. Go ahead.
Yeah, you have one question. Yeah.
I have a question.
Sure, go ahead.
How far are we from a vaccine? I mean, we've been hearing this in the news all the time, but what are your thoughts? Like,
usually, there for any research or vaccine, there are 3 stages. First stage is to isolate and find the virus and develop some antibodies against it in the lab. And second way is to try it on some volunteers, which we are doing in the second stage now. And there was some success with the second stage. Volunteers have been vaccinated and they exposed to the virus, did not catch it, was good. The third stage was the final stage. You have to test on the public. Volunteers, of course, or public, more data has to be needed to see the virus or the injection. This is an attenuated virus. So the coronavirus, they weakened it in the lab and they inject it in the body, and the body reacts to make antibodies. They want to be sure when they inject in you, it does not cause you the coronavirus. It just makes you sick, like little flu, cough, things like that, mild. And once they prove the third stage is a good virus vaccination, they are going to approve it by the CDC, Center for Disease Control and Prevention in the United States, by the WHO. The recent one they discovered in, or they said in Russia, the lack of the third stage trials is not published by scientific respected communities. They doubt the results, and they are not recommending it until now, until it's proven. And that's why the third stage takes time. It will not be done by the end of this year, hopefully by the end of this, inshallah, and the vaccination will be ready by beginning of next year. That's the most prediction. About 120 centers around the world are working on it. So that's why it takes time with this virus. You cannot just have a vaccine right away. And I explained to you the stages. Now we're in the third stage, the final one. Hopefully, inshallah, by the end of this year, will be 1 or 2 or 3 approved and will be ready for the public by the first of the year.
Thank you.
Any other questions?
Anyone else have any question from Glendale for Dr. Noor? Anyone else have a question for Dr. Noor from Glendale, for the brothers and sisters? If not, we'll ask Dr. Noor to give dua, and we'll end the Zoom meeting.
Thank you very much. Brother Abu Khur, and thanks for Hawthorne, and may Allah subhanahu wa ta'ala protect us. And Sayyidina Ibrahim made the dua, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينِ. When I get sick, Allah who gives me healing, and make dua that اللهم احفظنا بعينك التي لا تنام وعزك الذي لا يضام من كل شر وبلية ومن كل هامة أنت آخذ بناصية إن ربي على صراط مستقيم. Thank you very much. May Allah subhanahu wa ta'ala protect us and protect you from this disease. Assalamu alaikum wa rahmatullahi wa barakatuh.
أكرمكم الله ضاعف الله أجرك. May Allah subhanahu wa ta'ala bless everyone and protect all the Muslims and all humanity from this. Ameen. جزاكم الله خيرا. Please remember Dr. Nuh, your dua and his family and all the community and all the Muslims.
Question for the doctor, please.
Sure, Malcolm.
Okay. So my brother-in-law, I guess in Syria, he has COVID. My wife asking, can he take aspirin and antibiotic? Would that help?
The aspirin, it will help in certain cases, but we recommend you take Tylenol or acetaminophen. It's better. Antibiotic, if you get secondary infection, we give some people who get like pneumonia, community pneumonia, severe cough without the actual pneumonia of COVID, we give them antibiotic. It will help. But there is no proven medications for the real COVID, especially pneumonia until now, is except the remdesivir antibiotic that gives only in the hospital by injection. But you can still take some antibiotic to prevent from complicating any bronchitis, like from getting worse. Yes.
I see. Jazakallah khair. Doctor.
Someone have a question again. iPhone, who's I have no idea. Wael or Brahmi or whom.
That's fine.
Okay, anyone? Questions? I see someone unmuted.
Jazakallah khair, Dr. Noor.
Anytime. You have any question? Okay. And I'll leave you again with that slide, which is an excellent slide. And you can just take a look. It tells you how to protect yourself. Washing, if you have to have a shopping cart, clean it with hand sanitizer or they disinfect it. Many markets they do now. If you touch gas pump, sanitize your hands. Keep social distancing, 6 feet at least from other people in crowded places, buses. And protect also your children the same way. Eat healthy diet, take vitamins, stay in more sunny aerated area, and make dua. Allah protect you from all this. Thank you very much.
Dr. Noor, if you could get a picture of it and send it to me, then I could distribute it to the groups, inshallah.
Sure.
I could just show that and they could enlarge it and be able to see it much better, inshallah. Just send me a picture, whatever the format of pictures is, and I could distribute it. Jazakumullah khair.
Thank you.
Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Akramukumullah.
Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Yes, okay. I'm going to end the